The district's health director, Dr. LaQuandra Nesbitt. Thank you so much, Dr. Nesbitt, for taking the time to be with us tonight.
Thanks for having me, Leslie.
I know there is certainly a lot of frustration after the experience on the city's vaccination site today. You've apologized for problems with the vaccination portal. What's referenced here as a technical review failure? How did that stop people who were eligible from getting registered?
Sure. Leslie, as you and many of your viewers know, here in the district, we've been extremely committed to having an equitable process for our vaccine distribution, as well as how we allow appointments to be accessible to our residents and our essential workers. In doing so, this week, when our phase 1C was implemented, the first time where individuals with chronic health conditions were eligible for vaccination, it requires us to make changes to our vaccination portal. And in our process of making changes to that vaccination portal, one of the technical review processes did not catch one of the back end functions that would have allowed people's eligibility to be determined. So we completely understand how frustrating of a process that is, especially given that today was a big day for many of our residents who have those qualifying and chronic medical conditions where they have been anticipating access to the vaccine since December.
And we know people were trying for hours on multiple screens trying to make this happen. For those who were promised this chance at an appointment in underserved zip codes, which you've been trying to get into and might have been uncertain even going into this about the shot, what would you say to them now?
So, you know what, Leslie, one of the things that I want to make sure people understand very clearly is that we're always trying and working very hard to improve the customer user experience with our portal. And we continue to make that experience better every time. We make improvements based on the feedback that we get. You know, last week we switched to an evening enrollment because we got feedback from people that said, hey, I'm always on my job at 9 in the morning and I'm unable to get on the internet or call the call center at 9 a.m. every single week. So I don't feel that I have the opportunity to really get an appointment. So we're an agency and we're a government who listens to our residents. So I want people to know that if you ever go on and you're not able to access an appointment because the amount of vaccine that we get right now just simply isn't enough to meet the demand we have from our residents every single week. Don't be discouraged or frustrated with the process. We want you to come back. Pay a visit to us the next time the portal comes open for you and give an attempt at scheduling an appointment. And I hope by now people know that for those residents with qualifying medical conditions who live in those high priority zip codes, we're going to host a special session for them this Saturday beginning at 9 a.m. To be able to hopefully rectify some of the situation and horrific experience that some of them had today.
As you just mentioned, you'll be back at this again tomorrow and Saturday. Friday, it won't just be certain codes, zip codes. It's going to be, even more potential volume. For Friday and Saturday, I guess the question is the city ready this time?
Sure. So we've again made the correction on the eligibility piece. So people who visit the website tomorrow, their eligibility will be confirmed and they will be able to move forward with scheduling an appointment and selecting one of the over 50 locations that we have throughout the city for people to be vaccinated that are scheduled through the portal. So we're really excited about that. The other piece that we want people to be mindful of is this the largest eligibility group that we've ever announced at a single time. So there are tens of thousands of people who are coming to the website to schedule. And so we're still working to make sure that the bandwidth and the volume that comes to the site that people won't experience a slowdown when they come. And it's also important for people to know that we have the call center as well for people who don't use internet, who don't go on computers, is that they can give us a call at 1-855-363-0333.
So it sounds like the best advice is to try both. If you can't get through on the website, try the call center.
That's right. And, or try the option that works best for you. If you have a person in your family who's supporting you in making this and scheduling an appointment, we created both tools to create an opportunity for people regardless of their technological capabilities and functions.
Well, Dr. Nesbitt, it's been a long day today, and you've had many long days preceding today and many long days to come. Thank you so much for your time tonight. We're wishing you a much better time going forward. Be well.
Thank you, Leslie. And you just want to make sure that everybody gets vaccinated when it's their turn.
Absolutely. Thank
Take
you.
care.